Hi, good evening, everyone. Welcome to the Secrets of Restful Sleep. My name's Marlene Grady. I am a supervisor here at R.P.S.G.T Sleep Center out in Newport as well as in Irvine. I manage that department. I've been in sleep for about 20 years or more. I started out as a sleep tech and now as supervisor. I've worked throughout California, also in Hawaii, in this area of sleep management, and worked for many sleep centers throughout California, helping to accreditate labs as well as manage them. So tonight's topic is secrets of restful sleep. So I'll give you a little background on sleep, why it's important, and we'll move forward. So sleep, as you know, promotes good health. In America, 70% of adults report that they obtain insufficient sleep at least one night a month. And 11% report insufficient sleep at least every night. So some of most of our sleep disorders that you may know of are sleep apnea, insomnia, restless leg syndrome, and narcolepsy. Did you know up to 8 out of every 24 hours is spent sleeping? 2/3 of adults throughout the developed nations fail to obtain the recommended 8 hours of sleep nightly. The World Health Organization has declared sleep loss an epidemic throughout industrialized nations. The shorter you sleep, the shorter your lifespan. There are many contributing factors to insomnia epidemic: phone stimulation, light from cities, noise from cities, long work days, commutes, less time spent at home, higher stress levels. Again, sleep is extremely important. So, do you find yourself watching the clock at night? How many of you do this at night? I'm going to share some secrets for restful sleep, and these tips will help get some better night's sleep. So, how many of you have experienced, with lack of sleep, irritability, mood swings, reduced productivity, sleepiness at inappropriate times, and of course, use of increased caffeine, alcohol, and or nicotine, according to American Academy of Sleep Medicine? Sleep really directly affects our mental and physical health. So let's talk. Why is sleep important? Well, it increases energy, helps with our metabolism, really improves our cardiovascular health, optimizes our immune system, and of course, lack of sleep can make some vaccines less effective, improves brain function, attention, concentration, improves memory, and enhances our mood, decreases our anxiety and depression. Good sleep is really vital to our bodies and for our bodies to repair, regenerate, and recover, and help strengthen, again, the immune system. As we just talked about why sleep is important, again, poor sleep impacts hunger, weight loss ability, blood pressure, blood sugar levels, and contributes to a poor immune system. Mental health, sleep disruptions contribute to all major psychiatric conditions, risk of developing Alzheimer's, risk of coronary artery disease, stroke, heart failure, and even a risk of cancer. Sleep, again, represents 1/3 of everyone's life and impacts how we live, function, perform during the other 2/3 of our life. Again, sleep really directly affects our mental and our physical well-being. So, Let's talk a little bit about prioritizing sleep. As we know, it's an essential function that allows our body and mind to recharge, leaving us refreshed and alert the next day. It increases energy, helps promote metabolism, and again, improves our cardiovascular health and our immune system, brain function, attention, concentration, enhances mood, and of course, decreases anxiety and depression. So, what are today's challenges? So, life is not the same the last few years. Changes in our sleep pattern have really increased, decreased sunlight exposure, lack of exercise, and weight gain. Anxiety, stress also about the coronavirus, isolation, depression, increased drug use, increased screen time, and stress on relationships. More work, stress-related fatigue, headaches, GI upsets, weight gain again, poor attention span. No breaking away from the everyday life. Technology 24/7 around us. These make big impacts. So let's talk about what is sleep hygiene? How does it affect us? Today, I'm going to give you a couple secrets to restful sleep and good sleep habits, good sleep hygiene. Research has given us guidelines to enhance good sleep, and when using these strategies, it can help to improve long-term solutions. The term sleep hygiene, again, is used to describe good sleep habits and habits conducive to maintaining good health and preventing disease. Again, research has developed guidelines and tips to help us find strategies to improve long-term solutions. So it's time to sleep. Is it restful, or is your sleep filled with anxiety? For many, sleep is beneficial. It's a restful time which helps restore the mental and physical health. For others, it is a time when hours are filled with frustration, anxiety, and throughout the night, but cannot really function very well the next day. So, looking at this picture, what is going on? We've got somebody in the bedroom, we've got a bright light on, we've got them drinking coffee at night, looking through today's work agenda perhaps. Again, this person's overly stimulated, and the lights, the laptop, the coffee, working in bed, phone next to them, not a good start. So how much sleep do we need? Well, I have a little chart here that shows all the different age groups. And for adults, 7 to 9 hours is what is looked at. Now, this is going to vary between people, but in most cases, getting 7 to 9 hours is a good start. So, during the night, when we sleep, we typically go through different sleep patterns of non-REM and REM sleep. As you see on the picture, our sleep patterns during the night move in and out of these various stages, and going through all these stages is called a sleep cycle. And each sleep cycle approximately 70 to 120 minutes long. So your typical sleep architecture is to enter from non-REM to REM sleep roughly every hour and a half to 2 hours throughout the night. Most people typically have around 4 sleep cycles through the night, meaning that we have about 4 dreams each night. Each night, the dream sessions are about an hour, hour and a half apart. These vary again, individual, and are affected by various factors, which could include age, could include medication usage. REM sleep, as we all know, is the sleep, dream sleep we call it. During this stage, we experience bursts of brain activity, including hallucinations, mental imagery, that play in our minds as narratives. There is also an increase in this REM sleep of eye movements, breathing, heart rate increases during the REM sleep. The pulse quickens, and if you wake up in the morning and you remember your dream, you might have just come out of that REM sleep dream. So, what can we do better? Take a close look at our own sleep patterns and our own stress levels and our own diet and our own exercise. We really have more control over the quality of sleep than you realize. Getting enough sleep may seem difficult. The cure for sleep concerns can be found in your daily routine, according to the College of Cardiology. Research shows sleep disorders have direct adverse effect on cardiovascular system. So, how modern life today can alter your body's production and shift your circadian rhythm? The more you're awake, the more you add to your sleep debt. And if you nap, you take away from your sleep debt. So you need to build up a certain amount of sleep debt in order to sleep at night. The sleep-wake cycle is a daily pattern which determines when it's time to sleep and when it's time to be awake. For most, 24 hours is divided approximately 8 hours of sleep, 16 hours of wakefulness. For most, again, the ideal sleep cycle is 7 to 9 hours. So I'm going to share tip number 1. Keep in sync with your body's natural sleep-wake cycle. Keep a regular sleep-wake schedule. And by doing so, you're going to feel more refreshed, more energized than if you sleep the same number of hours at different times. So, in other words, go to sleep and get up at the same time. And this helps to reset your body's internal clock. Choose a bedtime when you normally feel tired, and be consistent. Avoid sleeping in on weekends. Again, keep a structured schedule. Wake up at the same time each day, make your bed, shower, get dressed as if you were going, even if you're staying at home, even if you're going out, plan your meals at the same time each day. Have planned breaks during the day. Start a nighttime ritual as you transition into that sleep zone at night. Have a goal. That goal should be a goal to sleep, giving you a healthy lifestyle and healthy sleep. Also, fight those after dinner drowsiness calls. Call a friend. Do something stimulating. Or you may wake up later in the night and find yourself in a difficult spot trying to return back to sleep. So, again, during the day, sunlight, blue light. At night, minimize the lights, the screen exposure, filters, blue block glasses. Avoid screens at least 1 hour prior to bedtime. To keep that regular sleep-wake schedule, doing so you'll feel more refreshed, energized, and again, expose yourself to daytime when you get up. Lights, natural light at home if you can't go outside. Sometimes using a light box can be helpful. That stimulates sunshine. And at night, when it's time to sleep, make sure that room should be dark. Use curtains or shades to block light. Use dim night lights in the hall or bathroom. The blue light emitted from technology devices such as phones, tablets, computers, And TV screens are very disruptive. Again, tone down the blue light, putting the devices into night shift mode. Most devices, there's an app that shows you how to do that. Again, try to remove the technology out of the bedroom. Bedrooms should be made for sleep only. Our next tip, again, tip number 2, control your exposure to light. Melatonin is a natural hormone occurring and controlled by light exposure that regulates the sleep-wake cycle. Again, your brain secretes more when it's dark, making you sleepy. How to influence your exposure to light during the day. Again, expose yourself to sunlight in the morning. Light will help you wake up, keep you alert, spend more time outside if possible during the daylight. Walk or exercise, again, natural light into your home or workspace. And if necessary, the light box will help stimulate sunshine. As we know, technology today, phones, tablets, computers, TV games, and video games, they're among us, they're around us. According to the National Sleep Foundation and research, modern bedrooms are now filled with a range of technology, gadgets, which means we have constant access to our phones, tablets, games, and other devices. So at night, the bedroom should be conducive to sleep. Use of cell phone, computer, or those video games before bedtime can cause daytime sleepiness, poor quality, interrupted sleep, waking up unrefreshed, difficulties falling asleep. Could cause drowsy driving, increased sleep latency. Again, a tip for you to turn off and remove devices. If you can't do that, place the device across the room, perhaps put a towel over that. So if you have to get up, you're not looking to see what time it is or why I'm up again. The bed should be a comfortable area for you to sleep. You should have a good mattress. Again, avoid using computers, having the TV on while you sleep, or a phone or tablet near your bed. The bedroom really should be only reserved for sleep. It should be a peaceful environment. The peaceful bedtime routine will be a strong signal to your brain that it's time to wind down by keeping your room dark, cool, quiet, keep that noise level down. Again, for some it may be difficult to reduce noise level outside of your home. Earplugs can help. Keeping the temperature of the room makes a big difference. A temperature around 65 Fahrenheit and 18 Celsius would give good, adequate ventilation. Making these small changes to your environment will help and make a world of difference the next day. So, tip number 3, exercise during the day. It's been proven that people who exercise regularly sleep better at night and are less sleepy during the day. Again, exercise helps improve symptoms of insomnia and sleep apnea, increases the amount of time you spend in those deep restorative sleep stages. So even light exercise, such as walking, improves quality of sleep. And it may take some months to get into these new habits, but be patient and focus on building easy, attainable habits that'll stick. Again, take a break from Zoom. Anticipate times that when you get tired during the day, just go out for a walk. There's lots of opportunity for people where you can exercise regularly and you will sleep better at night. Again, exercise does improve symptoms of insomnia sleep apnea and increases the amount of time you spend in those deep restorative sleep patterns. So, tip number 4, be smart about what you eat and drink. So, we ask that you limit caffeine and nicotine. Caffeine can cause sleep problems up to 10 to 12 hours after drinking. Avoid big meals at night. If possible, make dinner time earlier. And avoid heavy, rich foods within 2 to 3 hours of bedtime. Another ask would be to avoid alcohol before bed. Now, it may be helpful for you to relax with a drink or so, but it can interfere with sleep and your sleep cycle once asleep. Also, avoid drinking too many drinks or too many liquids at night. Doing so also may result in frequent trips to the restroom. And avoid sugary foods and refined carbs. They can trigger wakefulness during the night and pull you out of that deep restorative sleep stage. So eating before bed may also lead to indigestion and other sleep issues with perhaps GERD. Again, if you need a bedtime snack, keep it light, perhaps a light bowl of cereal, some milk, some yogurt, a banana, something that's very light and easy to digest. So, when we have unhealthy daytime habits and make poor lifestyle choices, leaving us to toss and turn at night, we can expect them to adversely affect our sleep, our mood, our immune system, our brain, our heart health. And as you know, they can impact our vitality and cause weight gain. So also, we had just talked a little bit, but common problem areas, alcohol makes us more likely that you will be getting up during the night. Also known to shorten sleep latency. Sleep can be fragmented throughout the night and contribute to our daytime sleepiness. Sleeping pills can leave you tired the next day. Medications may affect the ability to also fall and stay asleep. So let's talk a little bit about nutrition. One ask is to keep a healthy diet. Stay hydrated. Lean meats, vegetables, fruits, perhaps a Mediterranean diet. Limit fat, sugar, salt intake. Again, limit alcohol intake to 1 glass, no caffeine after noon. Place a limit to when you stop eating. Ideally, avoid food and alcohol intake 2 to 3 hours prior to sleep. That way you'll be able to metabolize and digest better. So with that, we'll move on to our tip number 5 for tonight. So wind down and clear your head. Again, taking steps to manage your stress levels, learn to curb and that worry habit, the worries of the day. You can also try to develop relaxation bedtime rituals to help prepare for a mindful, prepare the mind for sleep. The more overstimulated your brain becomes during the day, the harder it is to kind of slow down. Take some deep breathing exercises. Those help. Breathing from your belly rather than from your chest can activate relaxation. That response can also help lower your heart rate, your blood pressure, and your stress level. So meditation is another area. Meditation can help you wind down and clear the head at bedtime. There are various relaxation techniques. There's books, apps, areas that really can help de-stress. For stress relief, again, there's plenty of resources available that can help balance this stress level. A quick look at the brain before and after a 10-minute meditation. This stuck out to me when I saw that. meditation does help. It does have calming effects for us. Again, deep breathing, stretching, yoga, meditation, headspace. A lot of people use that now. Calm, prayer, reading. Whatever fits for you, whatever helps. Even music is helpful as long as it's calm music. So with that said, we're going to go to tip number 6. How do you improve your sleep environment? Again, peaceful bedtime routine sends a strong signal to the brain that it's time to wind down. Making small changes to your environment can help make a world of difference. Again, make that bedroom environment conducive to sleep. As we mentioned earlier, keep your room quiet, dark, cool. Keep the noise level down, temperature cool, and make sure that it's reserved for sleeping only and intimacy. Again, try to avoid technology, computers, phones, and tablets in bed. And as we talk about nighttime, when it's time to sleep, the room should be dark and conducive to sleep only. Tip number 7, learn ways to get back to sleep. So many of us get up during the night multiple times. It's normal to waken briefly during the night, and if you're having a problem falling back to sleep, some of the tips can help you. We ask that you get out of bed. Don't just lay there if you haven't fallen asleep within 20 minutes. Perhaps doing a non-stimulating, low-impact activity. Perhaps reading a book, looking through a magazine at a dim light. Do a puzzle. Resist picking up the phone and looking at what time it is, or looking at an electronic device, or turning on the TV. Postpone that worrying and brainstorming of for tomorrow. Again, if feeling anxious, make a brief note on the paper or on a sheet of paper. Write down what you need to be dealing with tomorrow and put it aside. You can look at it in the morning when you're wide awake and more so alert. So with that said, if you can't sleep, we ask that you get up and do something instead of just lying there and worrying. According to Dale Carnegie, it's the worry that gets you, not the lack of sleep. I'm going to talk just briefly on jet lag, because that often is a question when working in sleep. Often that happens when you travel across multiple time zones and you have trouble adjusting to perhaps a new schedule, going from east to west or west to east. Again, here are some tips. Gradually start adjusting to the new time zone or the new time zone schedule, even a few days prior to leaving for your trip. Once you reach that destination, spend time outside. Get that sunlight. That will help you adjust. Again, avoid caffeine and alcohol, which tends to make jet lag a little worse. Again, they're stimulants that will keep you up. So with that said, I'm going to go over our last tips here. Again, don't go to bed unless you're sleepy. And if you're not asleep in 20 minutes, ask for you to get out of bed till you are sleepy. Again, keep a regular schedule. Avoid taking naps during the day if possible. And if you have to take a nap, keep it down to 15 minutes or so. Again, don't have caffeine, after lunch. Don't have a beer, wine, or alcohol within 2 to 3 hours of bedtime. Don't have a cigarette or any other source of nicotine before bed. It's a stimulant. And, don't go to bed hungry, mad, anxious, worried, stressed out. Avoid rigorous exercise within 3 or 4 hours of bedtime. Making bedtime quiet, dark, and a little bit cool. Reserve that bed for sleep and intimacy. So again, I'm just going to summarize the tips. Keep in sync with your natural sleep-wake cycle. Tip number 2, control your exposure to light. Tip number 3, exercise during the day if possible. Even just a few minutes of exercise doesn't, even just going out for a walk will help. Tip number 4, be smart about what you eat and drink prior to bedtime. Tip number 5, wind down, clear your head. Tip number 6, improve your sleep environment. Make it conducive to good sleep. And tip number 7, learn ways to get back to sleep. Again, sleep is the time when the body can repair and heal itself. The mind and emotions also become balanced through sleep. Getting a good night's sleep is crucial to good health, our well-being, our ability to experience joy, peace in our life. Here are some references that I used for this. And I also help teach a cognitive behavior therapy class for Hoag Sleep Health and our behavioral medicine program. There's some information on that here. And so I'm getting some questions. How often can I take melatonin? So with that said, I know that's a common question and many people utilize melatonin. I think this would be a great question to ask your primary care physician or a sleep specialist that you see. I don't really want to get into medications, and because people do take multiple other medications and they may interfere with each other. But these types of questions are good to ask when you see your physicians that care for you. Any other questions in the chat? Well, I hope some of this had helped. Again, be easy on yourselves. These are just a few tips that may help, and I appreciate the time, and have a great evening and get a great night's sleep.